Washington State Department of Health. We have Dr. Umair Shah, Secretary of Health. Dr. Scott Lindquist, Acting State Health Officer. SheAnne Allen, COVID-19 Vaccine Director. Lauren Jenks, Assistant Secretary, Environmental Public Health Division. And a special welcome to our guest panelist, Dr. Mary Koehnke, naturopathic physician and board-certified naturopathic pediatrician. To begin today's remarks, we will open with remarks from Secretary Shah. Dr. Shah?
Yeah, can you hear me, Julie?
Yes, I can hear and see you. Great.
Fantastic. Well, welcome everybody. Thank you for joining us. I want to just start with a few messages. First of all, for some of you who've been following me on social media, you know that I just commemorated 6 months as the Secretary of Health for this incredible state. And I just want to thank everybody for the warm welcome. I didn't realize we were going to have heat in the process here, but the warm welcome as we move into, or as I look back on this last 6 months, an incredible amount of gratitude on the work that we have done, the progress that we have made. Obviously, I came in at a very difficult time when vaccines were just arriving into the state of Washington. In fact, I believe it was just a few days before I arrived. We were about to start the legislative session. The holidays were about to be here. We were in the midst of our third wave, and we had a lot of uncertainty that was still ahead related to this pandemic. And now you fast forward 6 months, and we have made an incredible amount of progress. I just want to say thank you so much to all of you, our media partners, and all of our partners across this great state. I still have not seen or been able to visit because, one, we're in a pandemic and a lot has been virtually, but also because of just the incredible amount of work that's been required. So many of the partners that I would love to see across the state, and I am really looking forward to the road ahead. Once we get past this pandemic, or as we get past this pandemic, but we are still in the midst of the pandemic, and I don't want to focus too much of everything ahead when we still have a lot of work here to end this pandemic. I want to thank Lacey in particular. Lacey Fehrenbach has led our COVID-19 efforts. As you know, she has led our incredible team at Department of Health. Everyone that you see on this media briefing and those who have been on the media briefing previously, and certainly those who are not even on the media briefings but have just been doing the tireless work behind the scenes day in and out and weekends and holidays to make sure Washingtonians are safe. And so Lacey, it's a shout out to you and shout out to all of our team members for just the incredible work that public health has continued to provide and to model throughout this pandemic. And certainly that extends not just to all of us at the state, but certainly our local partners and our private sector partners. So I want to say thank you. The other thing that, as you know, over the last 6 months I've talked a lot about is this really Texas to Washington piece. And, I've even called it a hashtag TX to WA. And what I did not know was that Washington was going to have the record heat that we have had in oftentimes what I would associate from my former stomping grounds, which is Texas. And so we are concerned about the extreme heat that is really upon us. And so I want to just have this graphic come up because I do think it's really critical that we spend a little bit of time of thinking about, and I know I've been watching some of the media messages over the last couple of days, so thank you for sharing messages to people about how they can stay safe indoors. And obviously we know that there may not be as much air conditioning here, but wherever you can, if you can find a place where there is air conditioning, we certainly want to make sure that people are doing what they can to protect their bodies and themselves as well as their loved ones. Drinking plenty of fluids, water, but avoiding those fluids that contain alcohol or lots of sugar, or what I've got in front of me, a little bit of caffeine. You want to make sure that you're avoiding those kinds of things because we certainly want to make sure that you're hydrated. And we certainly want to also make sure that meals are balanced and light, and you want to be very careful, especially with kids and pets, not to leave them in a parked vehicle because the temperatures can get exceedingly hot in those parked vehicles. And then certainly strenuous activities. We do want to make sure that people are taking it outside because of the pandemic. This is the challenge. We also want to make sure people are being safe in the process, especially when it comes to being outdoors during the middle of the day. I think that is absolutely critical. And then finally, and certainly Dr. Lindquist and I can speak more about this if you have any specific questions, but we want to make sure that people are thinking about heat illness and certainly the signs of that and how to move into more of a safer, cooler location, resting, and certainly cooling down as best you can. And if things just don't look like they are getting better, that you certainly seek medical attention. The final message that I would put on here is that it is also going to be a bit of a change when it comes to the heat related to COVID-19 safety precautions. And we want to make sure that people do not forget that we're still in the midst of a pandemic. And obviously we still have masking rules, especially in certain communities or certain establishments. But when it's hot, people may tend to say, I'm not going to take my mask with me because I'm not going to wear it. And we want that not to be the case. We want people to absolutely have their mask with them, even when it's warm. And certainly if they're in crowded or indoor settings, we want to make sure that people recognize there's still a number of people across the state that are not vaccinated. And it's really important that we keep ourselves protected. And that also means that if you have any symptoms of COVID-19 that you get tested, but also that you avoid being around others. So again, messaging around heat, but also messaging around how you protect yourself and not forgetting that we're in the midst of a pandemic. Just yesterday, I had a chance to be with our partners at our PBS TV station in the Seattle area for an in-studio interview. It was their first in-studio interview, and I just wanted to say thank you to them. It was very different to be in an in-studio setting, and I also really want to make sure that I recognize the fact that we have been doing so many things virtually that things will really be about how we have learned behavior, but also how we unlearn behavior. And I think that is something that we also will need to be focusing on as we move forward. Unlearning behavior or relearning behavior in a way that allows us to be mindful of the precautions that we need to continue to take while we're in this pandemic. I want to give a particular shout out to Jessamyn Mcint with Q13 Fox. Her team did a great job of really allowing Lacey and I to talk about what we have seen during this pandemic, and that was great yesterday. But I also want to thank the Kraken, because we had a chance to visit along with the governor, who, as you know, was also in Auburn yesterday at a vaccine clinic. But before that, he came to the Climate Deal Arena and visited with the Kraken and their leadership. And I want to just give just incredible amount of kudos to the Kraken, because not only have they been enthusiastic partners throughout the vaccine process, but they're really interested in how they can continue to partner moving forward. I know you've heard and seen a lot about the Climate Deal Arena. It is the real deal. It is quite impressive. And we certainly want to continue to partner with, especially on environmental related issues. And Lauren Jenks is on in case you have any questions about environmental or even about heat as we move forward. So if I can have the first graphic come up on the vaccine section here, let's go ahead and jump in as we always do with the reminder of the slide. I know it's been months and months of showing this, but it just bears reminding that, again, this is really a complex equation about supply, logistics, and demand. We've largely overcome is probably the right word, supply issues and logistics issues, although every so often you get something that pops up, and it's really about demand. And demand has really been what we have been continuing to monitor, and we are seeing a softening or even a slowing down across the country. I think you've all seen the messages and the information of what's happening elsewhere in the nation. We are seeing that certainly here in Washington as well. It is not completely surprising because we have obviously vaccinated a tremendous amount of people, but also it is concerning because we still have a lot of people that are still not vaccinated. So I want to, if we can go to this next slide, I know that everybody is very interested in where we are with things. I'm sure the question that's on the mind of everyone is whether we've reached that reopening goal of 70% earlier than June 30th. And remember, that's the state population 16 years of age or older with at least one dose of vaccine. Right now, we are at 68.0%. As you can see here. So we are still close. We're up from last week. It's a slight increase from the percentage we shared last week. And Lacey is going to be sharing more detail on this because that 68.0% still is a couple percentage points away from that 70% early goal that we have. And remember, if we don't hit that 70%, we're still going to be reopening by June 30th, which is next week. If I can go to the next slide, this is just a tremendous amount of progress and efforts on so many partners in the public and private sector. As of June 20th, we have more than 7.6 million doses of vaccines that have been given across the state of Washington. It's just a tremendous amount of effort. I know that there's been a lot that we have been challenged by and we've been working through, but we have just done an incredible job as a state. And I mean the entirety of our state, not state government necessarily alone, but everybody working together. Show the next slide. And this translates into more than 3.7 million people that are fully vaccinated, which represents just shy of 60% of our population, 16 plus, and that is great. But that again reminds us that we still have people who are not vaccinated. I'm sorry, I said 16 plus. I should have said 12 and over. If I could go as well as we continue to move, I just want to remind everybody that we still have our 833 Vax Help number. I do want to also make mention, I know this has been a question that we've had as well about the Shot of a Lifetime initiative. 87% of our June callers to our state hotline said that they had called because of Shot of a Lifetime. And this is people who are seeking appointments. So again, I think this really recognizes, and I want to thank the governor and the lottery partners for the work to continue to incentivize and encourage people to get vaccinated. It's not too late, obviously, to get into the drawing. Obviously, all you have to do is to get vaccinated, and that is really what this is all about. So thank you for that. But I also wanted to just underscore that we have seen an uptick in those in the percentage of people that are looking for appointments, and we believe that that is related to the Shot of a Lifetime initiative as well. We can go to the disease trends now. These are all promising. Again, I need to just, I continue to feel like I say things are promising, but we also want to make sure that people are not feeling like we're completely out of things. We need to keep up with our vaccination efforts, and certainly precautions need to continue to be maintained. As you can see, back early in the spring, we had our first wave, then in the summer we had our second wave, in the winter we had our third wave, and then in the spring here we had our fourth wave. And that is, again, the great news is that the case rates and hospitalizations are mostly declining. We do see some projections that we may be starting to see some flattening on our case counts moving forward. And again, these are projections. We're not seeing them yet. And that is just a reminder that as we are celebrating and commemorating 6 months of so many efforts in our state reopening, we still have people that have not been vaccinated. We still have people who are unprotected, and we still have people who are going to be at risk for COVID-19. And so we want to make sure that that message of vaccination continues to be there. If I could get to the next slide here. Again, I show this on almost a weekly basis, that again, just a reminder that you are at 15 times if you're 65 years of age or above, or 45 to 64 years of age, 25 times higher estimated admission rates for those who are unvaccinated compared to those who are vaccinated. Again, this underscores the importance of vaccinations. I think it's really important for us to, as we're seeing hospitalizations and cases come down, but we're starting to see some flattening as we are seeing a slowing down of vaccinations across the country, including in Washington. And as we are concerned about this real rise in the Delta variant that Dr. Lindquist spoke about so eloquently last week, is going to be speaking more about that as well. These are a combination of trends that give us some pause that we are not completely out of the woods here. And we want to make sure that everybody is doing whatever they can to help us continue to fight this pandemic. We've had more than 448,000 confirmed and probable cases of COVID-19 and more than 5,800 deaths in the state of Washington. Again, we've made incredible efforts, and we've done so much to protect lives. I'm proud of the efforts that we've had here in the state of Washington, but I do want people to be remembering that they can help us. I know a lot of questions are out there about the variants, and people are asking, what about the Delta variant? What about this variant or that variant of concern? I want really people to let us worry about the variants, and I want people to do their part, which is to get vaccinated to protect themselves and those around them. So that is really critical to what we are, really the message here today is to do your part and get vaccinated. We're not completely out of the woods, and we want to have a great finish line here as we get closer and closer to the June 30th timeline. I want to remind everybody that reopening means that the state is open for business and recreation. Vaccinated people can mostly go about their lives like they were before the pandemic, with a few limited exceptions. For example, with large-scale events, or if they're in public transportation or high-risk settings. That does not mean that there is no longer risk in the state of Washington, because we still have significant portion of our state that more than half of the state that's not fully vaccinated, when we look at those who are under 12 also added into the mix. So we want to expect folks to get vaccinated. We want people to do the right thing, but we want, if folks are not getting vaccinated, especially in certain communities across Washington, we're going to continue to see clusters and even outbreaks in those areas, and that is a real concern for us. And again, that is going to mean that the pandemic will just drag on even longer unnecessarily. So we don't want to see that. We want hospitalizations not to increase. We certainly want to make sure that as the restrictions become less so, that we do not let down our guard. The Secretary's order for masks will still be in place. We want people to respect and that's especially for unvaccinated people, and then certain settings for vaccinated people, again, as I just alluded to. And we want people to remember to respect the rules of the room for businesses and local restrictions or establishments or communities that may be out there. So I wanted to just make mention of these things. There's a lot that's coming up, and certainly July 4th is coming up. We know the July 4th gatherings are going to be coming up, and we want people to, follow the appropriate public health guidance that we'll be providing on both, vaccinations, and especially if you're unvaccinated, taking it outside and following mask and social distancing guidance. I also know that June 30th is going to mark a change for us here at Department of Health. We are going to begin pulling back on some of the regularity by which we have been having these, for example, media briefings. We've been doing these for well before I got here, since essentially the beginning of the pandemic. And again, kudos to our team before I even got here, and Secretary Weissman, Lacey, and everyone else involved, and all of our media partners for these weekly gatherings, and especially over these last 6 months. But we are going to be looking at what's the right and appropriate cadence for that, obviously, to come back when we have something more urgent. But we do want people to recognize that we are moving into a different phase of this pandemic. This is an exciting time, but our work is not done. And so please get your vaccine, help someone else get their vaccine. And, I do know that that is something that is really absolutely critical to all of our work here moving forward. And I know I'm looking forward to this, the fellow panelists, including our guest who is going to be here to talk about really why it's important to get vaccinated and why it's so critical that we continue to champion this message together. The final thing I will say, healthcare providers, please do everything you can to help us get the message out to your patients, to those clients, to those individuals that have either are in your clinic or are not in your clinic. Please reach out to them and encourage them to get vaccinated. So thank you so much with that. And it's been 6 months and it feels like it's been 6 decades. We will be completely honest. With that, I will turn it over to you, Julie.
Sorry, I was unmuted so you could hear my chuckle. I think we all feel that six months feels like quite long, quite much longer for many of us. Now let's go to Dr. Scott Lindquist. Dr. Lindquist.
Yep. Yeah, just a reminder, I diagnosed the first case in the United States. Nobody has been doing this longer than the team that diagnosed it here in Washington. So to the rest of you, buck up. All right. So here's the big issue about variants. The rest of the country is really seeing an increase, a rapid increase in the Delta variant. That is not the case here in Washington State. Reminder, everyone was very concerned about the UK variant or the B.1.1.7 variant, or what we call now the Alpha variant, taking over and having an explosion of cases here in Washington State, and this really driving the epidemiology. And that just has not been the case. What we are seeing now is this Alpha variant is slowly being outcompeted by two main variants. One of them is indeed the Delta variant, but more important and twice as many variants is the Gamma variant. That's the P1 variant, or what we call the Brazil variant originally. That one is the one that is most concerning to me. It is at 24% of all our variants right now, compared to the Delta, which is at 9%. It's twice as many variants. And so it is very effectively outcompeting the Alpha variant and the Delta variant at this point. The other big concern, and the rest of the country isn't seeing this big spike in the Gamma variant, but we are in the Northwest. Again, Canada had a very large outbreak of the Gamma variant in British Columbia, and many of our counties here are seeing the Gamma variant. The other very big concern for this Gamma variant is that it's got the highest hospitalization rate of any of our variants. While everyone is concerned that Delta is going to have more death and hospitalizations, we are just not seeing that here in Washington. We are seeing more breakthrough cases proportionately and hospitalizations with the Gamma variant. So that really puts it in perspective for us. I think our future is to see B.1.1.7 or Alpha variant decrease continually. It's less than half of our variants at this point, and at one time was well over half of our variants. So with that, I'll leave it at that. And again, Washington State is one of these very aggressive states that is looking at genotyping. We're genotyping well up over 17% of all our isolates, and that's way higher than most other states. So I think we have a very good understanding of what's going on here in Washington State.
Thank you, Dr. Lindquist.
Welcome.
Our next panelist and guest panelist will be Dr. Mary Alison Koehnke. Go ahead.
Just unmuting myself. Good morning. Hi, I'm Dr. Koehnke. I'm a naturopathic physician and board-certified naturopathic pediatrician, and I practice medicine on the south end of Seattle. And I was asked to be here today to talk about the intersection between sort of integrative and naturopathic medicine and vaccination. So thank you very much for having me. Excuse me, I'm very happy to be here. I find that there is actually a lot of overlap between vaccines and integrative medicine, and that our philosophy and values in integrative medicine are actually very supportive of vaccines. There's a lot of misinformation going around and sort of, I think, false perceptions of that, but I hope to kind of illustrate for you what that relationship is. So I want to go through a few examples of how that plays out. So the first is in preventative medicine. Preventative medicine is one of the most important values in naturopathic medicine. It's something we really pride ourselves in and something that I think we do well. And vaccines are one of the most important pieces of preventative medicine. Preventative care can look like a lot of different things in public health and in day-to-day life. And when you go in for your well-child checks, you'll probably hear 100 examples of how to help prevent illness and injury. But vaccines are one of the single most important, well-researched pieces of that. And it's for that reason that myself and my naturopathic colleagues and also my conventional colleagues really strongly recommend vaccination. Excuse me. The second is in training our immune system. I think it's really phenomenal that we have the medical technology to actually train our already amazing immune systems to respond even better in the face of a pathogen. So I like to think of giving a vaccine sort of like sending my immune system to wilderness survival school. It's like saying, hey, immune system, get yourself prepared, get yourself trained so that when you see this threat, when you see this pathogen, which in this case is COVID-19, we are ready, we are trained, and we're better prepared to deal with it when it comes. And so I love the idea that we can actually use medicine to use our own natural systems in our bodies even better and more efficiently. And the third area of sort of philosophical overlap there is the area of first do no harm. And this is something that's talked about a lot in medicine, both in naturopathic and conventional medicine. First do no harm is a concept that that's looking at risk versus benefits to help in terms of preventative medicine and also in treatment options to help physicians and their patients work together to weigh out what is the most beneficial outcome for you, what's going to give you the most benefit here. And I find that with the COVID-19 vaccine, we really, giving it to my patients and saying, just by simply giving you a vaccine, I can help prevent you from being hospitalized, having serious complications, and even death. That really helps me rest easy at night to know that my vet patients are vaccinated. So it's for all these reasons and additional reasons that I do recommend my own patients to get vaccinated to COVID-19 and actually all their routine ACIP vaccines on schedule. And I know a lot of my naturopathic physician colleagues and also my conventional colleagues are doing the same. I hope what you hear from this, and I hope what you take away from it, is that medicine is really a team sport. Whether you're a naturopathic physician, whether you're an MD, a DO, whatever your specialty is, medicine is a team sport, and we need each other. We need to work together to end this pandemic, and vaccination is a huge piece of that. So if you're a person who's maybe a little on the fence, maybe you're thinking, I want to get a vaccine, I want to have that protection, but I have some questions and some concerns, I'd really encourage you to reach out to your doctor and ask. The same rules from elementary school still apply here. There are no stupid questions. There's nothing that's off the table to ask. So if you find yourself thinking like, if I could just get this question answered, then I would feel comfortable doing it, do call your doctor and ask. When my patients come in and ask me questions, I think, great, at least they're engaged. At least they're considering this and open to the idea of it. So I want to send you home with a couple of resources. One is ndsforvaccines.com. So NDs as in naturopathic doctor, NDS vaccines, ndsforvaccines.com. There's a lot of articles there written by naturopathic doctors that go through some sort of myths versus facts. And there's a couple about COVID that are very good. So I'd encourage you to look at it. And also on the CDC website, there's a page, there's a COVID vaccine page, and there's a myths versus facts page, and I was looking through it and thinking, wow, this is actually most of the clinical questions that I get. Most of the questions people come in asking are actually answered there. So if you have something that's been stirring in your mind, that you're wondering about, it might be worth checking out that page and seeing if it's answered there. So thank you for having me this morning. Take care, everyone, and I hope you'll at least consider getting your vaccine.
Thank you so much, Dr. Koehnke. Our final panelist will be Lacey Fehrenbach. Go ahead, Lacey.
Good morning, everybody. I'm here to give you a little more information on the numbers, as Dr. Shah mentioned. We, of course, recognize people are very anxious to hear how close we are on that 70% initiation goal in our state. I wanted to share that when we reviewed the data that DOH received from Department of Defense last week, we noted some discrepancies in this data. And upon working with DOD on this matter, we learned there was a change in the method they used to generate the report for us and share that information on people vaccinated in Washington state. This meant that the overall numbers that Department of Defense reported to DOH have decreased, and in turn, this reduction affects our overall statewide numbers. We've spent the past several days working with DOD to confirm and clarify the numbers, and it appears this data issue has been reconciled. The good news is that Washingtonians are continuing to roll up their sleeves, and Department of Defense, Veterans Affairs, and our own state providers here in Washington have all vaccinated additional people over the past week. This is how we train our immune system, as Dr. Koehnke mentioned, as individuals, and as a community, how we outrace COVID-19, including those variants of concern. And we're now at a combined 68%, as you heard from Dr. Shah. I want to note that this information is incredibly complicated to sort through, especially when you're thinking about populations that are moving around a lot. And we really, really want to thank our partners at DoD for working with us on this so that we can include their vaccinated soldiers and civilian community members in our state's progress toward that 70% goal. We also really appreciate their partnership on the lottery and our broader COVID response work. Together, we can move forward on our shared goals to protect more people in our community with these life-saving vaccines and help our state move forward on our journey to reopen, recover from the pandemic, and build more resilient communities in doing so. Back to you, Julie.
Thank you so much, Lacey. That brings us to the Q&A segment of today's briefing. We have 5 reporters in the queue. We begin with Arielle from the Spokesman Review. Go ahead.
Great, thank you. Here in Spokane County, we have a pretty low number or percentage of 12 to 15-year-olds that have received 1 dose. So I'm curious if that low vaccination rate is seen statewide and sort of why this is and how the Department of Health is going to address that hesitancy in 12 to 15-year-olds, especially as we go into summer. Thank you.
Arielle, thanks so much. I'm going to actually ask SheAnne to tee up to answer that question, but let me just make a couple of quick comments. One is, it's great to hear from you, so let me just to say that. But number 2, I really want to just highlight the fact that, you know, we have, from an adolescent standpoint, been one of the leaders across the country when it comes to adolescents getting vaccinated. I want to give an incredible amount of gratitude, not just to our partners who obviously have been doing everything they can, and Dr. Koehnke and her colleagues and everybody else, you know, as everything that we have done. I particularly want to thank our parents and the adolescents, the kids who have rolled up their sleeves. And just I was sharing with our team just recently that I have a colleague across the country whose child is now 4 years old and is in the trials for phase 3 for the vaccines that, you know, to even go from 6 months of age to the age of, or just under age of 12. And so, you know, kids are really stepping up. And I do want to make sure that we are appropriately characterizing this, that 1, we're a leader across the country in terms of adolescents who have been vaccinated. But number 2 is that children really have been doing the right thing. And I just want to give so much kudos to them. As you all know, I've shared this many times, our 3 kids are, none of them are eligible. They're 11-year-old, 7-year-old, 4-year-old, but our 11-year-old is so ready. She actually asked, is there a way for me to get vaccinated even when I'm 11? And I said, not quite yet. And so I just think it's so critical for us to make sure that the message is appropriate out there. Because sometimes when we say that, you know, there has been some decrease or a gap or some disparate number, is particularly with children. They may take that, you know, in the spirit of, oh, I'm not going to roll up my sleeve. And I just want to make sure that we're appropriately trying to give kudos to those kids who have done that and encouraging those kids who have yet not been vaccinated. And with that, SheAnne, I will go ahead and turn it to you.
Excellent, thank you. And one great question. We are really thinking and partnering with our providers, with our local health jurisdictions, with other organizations to offer additional strategies for providers that are enrolled in the program and not enrolled in the program. Really developing or enhancing our current toolkits so that all healthcare professionals can be having conversations about the COVID vaccine, answer questions, provide education, remove those myths, and then also to refer them to their providers for vaccination. Some of the examples of the strategies that we are implementing are developing depot sites so that we can repackage the vaccine and redistribute so that providers don't have to be nervous about wastage or not being able to use a whole vial. So depot sites across the state, also partnering with organizations on additional media campaigns so that we really can target those certain populations. That 12 and up population responds differently to other populations. So really enhancing those campaigns. We've heard from our providers that there's barriers with staffing. And so working with our volunteers, whether it be healthcare professionals or other professionals to help with like weekend clinics or evening clinics. And then also thinking about the new resources that will be specific to different age groups and, clear communication, helping to build confidence with providers when having these conversations. Those are just a couple of the strategies that will be targeted for 12 and up, and then all across all age groups.
Thank you.
And I wanted to quickly add, we are aware and working with some school districts that have done clinics for their adolescents. So that's another piece of the puzzle here. And we are working with our pediatric and family practice providers to catch young people up on all their vaccines. So this summer, school is out for most people, and we have a couple months here before we start the fall school year. Is a great time for parents to get their kids caught up on their routine childhood vaccinations and their COVID vaccine if they're eligible.
And little child checks.
Yes, one additional important strategy is also our mobile teams and our caravan, really using that and bringing the vaccine to different communities, to different venues that serve different age groups, whether it be concerts or sports events. So that is definitely a resource that we will be focusing on this summer as well.
Julie, I don't know if you want to keep showing that. That's a great, beautiful graphic that you showed, and then you pulled it down. So, when you have something to be proud of, show it up. Be proud of it.
I've got
There
lots
you
of
go.
buttons to click, and so it's like, got to keep them all up. So yes, there's the caravan graphic just to refresh everyone's memory. I wanted to put that up to support what SheAnne said. But thank you all for those answers. Now we will go on over to Steve McCarron with Como. Steve?
Thank you, Julie. I had two topics I wanted to follow up on. One was for Dr. Lindquist. What does the high prevalence of the Gamma variant tell you, and why do you think it's taken such a hold on the number of new cases here? And I'm wondering if you can remind us about the effectiveness of the vaccines against that variant as well. And then the other question that I have is just kind of overall, what is your message to people once we hit full reopening, whether it's going to be June 30th or earlier? Are you afraid that whenever that date is, those who are unvaccinated will sort of see that as an unofficial end to the pandemic, even though it's not over? And especially with July 4th just around the corner and a record number of people expecting to travel.
Scott, you want me to take the second question, and then you want to go, or you want to go first on? Why don't you take the Delta, and then I'll do the overall. Go ahead.
So it's really the Gamma that we're talking about here that's really getting a big foothold. I mean, the best way to think about this is it's like a gladiators game out there right now. These viruses are competing for people that are unvaccinated, essentially. And the ones that have better transmissibility due to some spike protein substitutions, that's both the Delta and the Gamma have those substitutions. We know, in fact, that the Gamma and the Delta have reductions in transmissibility. Reductions in neutralization from either monoclonal antibodies or from serum from people that have been vaccinated. So that is what's giving these two variants the upper hand in this gladiator game. And it'll be interesting to see, but the P1 or the Gamma variant is twice as successful right now as the Delta variant. And again, the rest of the country is looking at Delta, but I'm raising the flag about the Gamma variant here in Washington State. Clearly outcompeting. I'm not clear what, aside from its increased ability to transmit and these substitutions, I'm not clear why in the Northwest this has become so prevalent. And again, I alluded to this very large outbreak of P1 in British Columbia this past winter.
Yeah, and I'll take on this the second part of this question. Yeah, absolutely, we are concerned about that. That we not just in the state of Washington, but across the country. That we have seen that anytime you actually let me go back across the world. Anytime you take your eye off this virus has shown that it has a way to continue to do things. I've called it a super squirrely virus that has broken every play every rule in the playbook, and a super squirrely virus that has broken every rule in the playbook. And here we are at just around the corner with reopening at the state here, and certainly it's the right thing to do. It is time for us to reopen and get there, absolutely. However, for those who are unvaccinated, the message is clear. This is your time to get vaccinated. When you hear that there are variants out there, when you hear that you are at more risk for hospitalizations and potentially even more at risk than previously, because you're going to be around others. If you're in a clustering situation, you're actually going to be more likely to get exposed if you're around others who are also unvaccinated. This is a real concern for us, and we want to make sure that people do not forget the pandemic is not over until it is truly over. And that is really hard when you see what the June 30th, or as you mentioned, around July 4th, with expected travel and people really wanting to go out and about. And again, even this weekend coming with the heat, we are concerned about people not taking the appropriate precautions. And I'll tell you, this is coming from somebody who has been 25 years in Texas. It is hot in Texas, and so it was really tough during the summer to be able to get people to wear their masks, because the last thing you want to do is put your mask on when you're in the middle of really a very hot day. And yet that's still, if you're especially unvaccinated, that is what you are required to do to protect yourself and those around you. So I think there is really a lot of optimism for reopening, and there's also caution that we have to remind everybody that we do not want to see a tale of two societies, those who are vaccinated and thereby protected and able to go about their business without concern for this virus, and largely they can pretty much be back to, not completely, but back to normal. Remember, for parents, you want to champion and model behaviors for your kids. For example, our 3 kids who can't get vaccinated, want to make sure that my wife and I have our mask on around them so that they don't feel uncomfortable wearing their mask, especially our 4-year-old. And then at the same time, for those who are unvaccinated, it's absolutely critical. Get vaccinated. This is the time. Get vaccinated. There is nothing to hold you back. You've got free, available, safe, effective, right down the street vaccines that are here. And if you look across the world, there are so many people that would do anything to get vaccinated. Here we have that resource in the United States of America, and people unfortunately are just not doing that. And that is absolutely critical when we look at least get that first dose in before you get on the flight on 4th of July. Get that first dose in. This would be the time. July 4th is coming up, and it's really just about a week and a half, 10 days, 14 days away. This would be the time for you to get that first dose, to at least get some partial protection if you are planning on going elsewhere. And that is critical. When you are going somewhere else around the country, and we're hearing even people going around the world, and you don't know what the vaccination rates are there, and you yourself are unvaccinated, you are bringing potential risk on yourself. And that is a real concern for us. So sorry about the passion here, but you brought it up, and so I wanted to answer it fully, that we do want to make sure we're doing everything we can to encourage people to get vaccinated, and reminding everyone, including those vaccinated as well as unvaccinated, that we are still not through this pandemic.
I would like to add a little bit of passion to this, Steve. It cannot be understated how fortunate we are in this country to have 3 vaccines, wide access, and the number of people vaccinated we have 18 months into a pandemic of this size and magnitude. The rest of the world is catching up to us in terms of vaccination. And the pandemic doesn't end when we reopen Washington State. It ends when we protect communities all over the globe. And as long as we haven't done that, people who are unvaccinated here or anywhere are at risk.
Thank you. Our next question comes from Ryan with the Seattle Times. Ryan? Stand by, we are trying to unmute him.
All right, can you hear me now?
Yes, we can.
All right, thank you. Sorry about that. As you know, these gamma and delta variants seem to be winning out here across the state. Is there a point where we could have the reopening rolled back, or at least have targeted rollbacks in areas that have low vaccination rates and increasing cases and incidents of these more worrisome variants? And then I'm also wondering about how concerned should families be with children younger than 12 or people who can't get vaccinated about these variants, and what could this mean for in-person school come the fall?
Let me take the first question, and Scott, I'll let you grab the second one. The first question is really, we are not anticipating at this point that we are going to get to that point. But again, this pandemic has taught us a lot, that you don't let your guard down and you don't say absolutely never, because you just don't know. Could you see settings, not just in Washington, but across the country, where if people are not vaccinated, that you have a tremendous amount of increase in those unvaccinated communities that require you to take further action? You can see those scenarios. You can at least imagine those scenarios, but that's not really what we're at this point thinking is going to hopefully happen. We're trying to remain cautiously optimistic throughout. We hope that does not occur. Again, it's going to be up to community members to get vaccinated, and I think that's the critical message here. So we hope not, but again, we will continue to monitor the information. And I should have said that as we are also changing our cadence on the media briefings, we're also we may be changing our cadence in terms of our public display of some information based on the regularity. We were doing at some point 7 days a week, and then 6 days a week. We may be going to 5 days a week, et cetera. Even though we're changing sometimes how we display that information publicly, we are still monitoring it daily or on a regular basis internally. So I just want to make sure that point is also made clear. So Scott, I'll let you handle the pediatric question as well.
Yeah, so just a reminder that it's not the Delta and the Gamma that are the predominant strains here. It is the Alpha strain. That Alpha strain is decreasing as Delta and Gamma are increasing, but clearly our number one variant is the Alpha variant, just under half of all our variants. So with that, the good news is that kids are not getting infections at the rate of the 20 to 40 plus year olds. And that's where most of our transmission is being driven from. It's bars, restaurants, and long-term care facilities, essentially, in older folks. But having said that, there's one strategy that still works very effective against any of these variants, and that's mask wearing. So this will play into any recommendations for continued mask requirements into the school system as we go back into the next year. Reminder that every piece of evidence we have here still shows effectiveness of the vaccine against both the Alpha, the Delta, and the Gamma variants. So those are still effective for those who get vaccine. I think, as we've said, the biggest problem is if you haven't been vaccinated, unfortunately, the strains that are in waiting in Washington state are all variants with increased morbidity and hospitalization. So that is a concern, not so much for the kids. So still continuing to wear masks is the most effective measure for someone that isn't vaccinated.
I'll also quickly add, our schools have done a great job at implementing the health and safety measures. Those are layered prevention measures in the school environment, and the kids have been great at wearing their masks in this school year. The other thing we can all do as adults to keep our kids in school safe is keep the community transmission level of COVID low. So us getting vaccinated reduces the risk of an introduction of COVID-19 in a school.
Thank you. Our next question comes from Nicole at Como Radio. Go ahead.
Good morning. You mentioned that the Gamma variant has also been very high in British Columbia. I'm wondering, did the spread move from British Columbia to here? Is that how it got so high here? And then on that same note, what are your thoughts on the border situation right now? Governor Inslee and our local members of Congress have pushed for it to reopen for the sake of Washington businesses and for Point Roberts, yet the Canadian government has been kind of a little more staying the cautious route and it remains closed, although some restrictions have been eased now. I'm wondering, do you feel that it would be safe to reopen the border at this point?
Well, I can answer the Gamma variant very directly. We have no idea. We at the same time had the emergence of this variant here, and this variant has been pretty widespread across Washington state. So I'm not sure it's a very clear finger pointing at Canada for this. And plus, Canadians are so dang nice that I don't want to blame them, and there's not enough evidence to do it. So that's where we sit with that.
Well, after Dr. Lindquist just said that, I can't say anything about Canada. I agree. By the way, my wife grew up in Canada, so I have to be really careful. I would say from a public health standpoint, once you start to see variants in a community or in a state, then, it really is already there. And so I think as we've had this discussion over this entire year and a half about not just the, Canada-US border, but of, travel and business, the borders across various countries. I think it's really remains to be seen if those, policies that are either more restrictive or less restrictive, whether that changes things. I think from a public health standpoint, and Dr. Lindquist has already shared this, that you've already seeing the variants that we are concerned about thus far in our borders within the state of Washington. So that's already happening. So I don't think that question about whether a border open or closure is going to make that is going to change that aspect of it. It's already here. It's really going to be up to us. And as Dr. Lindquist mentioned about mask wearing, especially those who are unvaccinated, but also vaccinations. And those are really our two tools at this point. And then we're going to do whatever we can behind the scenes to continue to monitor what's happening.
Thank you. Our next question comes from Jessamyn at Q13. Go ahead.
Good morning. Can everyone hear me?
Yes.
Okay. Thank you so much, Julie. And thank you, Dr. Shah, Lacey, and Dr. Lindquist. Really appreciate your time each and every week. So for Dr. Lindquist, I wanted to know, you said you're sequencing at 17% right now. That seems to be increasing every single week, and it blows the rest of the country out of the water when it comes to those numbers. Do you continue, or do you plan to continue to sequence at a higher and higher rate? And what does that mean for the future of studies in the state and potentially the country? Also, we're looking at the 70% goal for reopening, but what do you think a realistic number would be for us to hit once we reopen? And some people might think this is fading into the background.
Well, I can answer the first part of that question, and then Dr. Shah is probably best to answer that second one. The goal, let me be really clear, the future of public health is genotyping. So not only will we apply this technology to COVID-19, this is going to be our way to investigate outbreaks with hepatitis C and hepatitis B and hepatitis A. And we've done it in small amounts so far. We do genotype every single tuberculosis case in the state of Washington. So it is a tool that is our future. So I'll leave it at that. The goal here for COVID-19, though, is to genotype every positive isolate that comes through the door. So we've got a ways to go, but that is the goal.
Yeah, and Jessamyn, thanks. don't know if we have what that magical number is where we want to be. Obviously, we've been saying as many people that we can vaccinate as quickly and as equitably as possible, no matter who you are, where you live, where you're from, that you have access to vaccines. I think the key message from us, especially as we're shifting to this stage of the pandemic, is really getting to those people that are still harder to reach and gaps that may be across the state. And so while we're looking at a percentage overall at across the state of 70% or higher, we're certainly also mindful of 2 or 3 things. One is we're mindful of that we may have kids who are under the age of 12 who are going to become eligible. So we're going to have to really think about that and focus on that effort when the vaccine eligibility is there. Number 2 is that if at some point boosters are in the mix, we're going to have to be thinking about that as well. And then the third thing is that geographically and within pockets or groups of people across the state of Washington, if we're seeing particular gaps, we certainly want to do everything we can to work with those partners on the ground to really help support their efforts and to continue to also encourage people to get vaccinated in those communities. So I'm not sure it's a true percentage that we're looking at as we get into this, this stage or this phase of the pandemic, but it's really trying to continue to look at where we're seeing particular gaps geographically or sociodemographically and really try to address those. I think that's going to be the key message for us moving forward, and not as much about a percentage, although we're going to continue to share that and follow that and monitor that. But it's really about where are we seeing particular groups of people that are at risk, where are we seeing hospitalizations occurring, and certainly if you have outbreaks or clusters, that is going to be of concern, especially when you're looking at everything from variants to breakthrough cases. So there's a lot that's really going to be in the mix here as we move forward.
Thank you. We have about 5 minutes left in the briefing, and our final question comes from Charlotte from GeekWire. Go ahead.
Hi. I'm wondering if the rise of new variants affects your advice on masking for unvaccinated or vaccinated individuals. And I'm curious about your advice for children and masking. For instance, I know they're masked at school, but what if they're just on the street playing with each other? If you have formal advice about that or not.
I guess the advice that I've been giving to our own kids is that if you're not sure about what's happening with the kids that you're playing with, either stay a distance from them or wear your mask or do both. So I think that's the message that I've been giving to our own kids. And I know that there have been these somewhat confusing at times information. And as a pediatrician, Dr. Lindquist may be able to answer this, and Dr. Koehnke may want to say something on this one as well. I think there is a real concern that people think that kids are not at risk for COVID-19, especially severity of disease, and therefore it is okay for them to interact. I think when you're obviously outdoors, the outdoors environment in and of itself is going to be less risky than indoors. But again, if you're around those who are not either vaccinated, not eligible to be vaccinated, you're not appropriately distanced, you're not hand washing or using hand sanitizer or masking up, that's again where you have to remember there is not a zero risk to these kinds of actions. And so I think there is really going to need to be a shifting, as I mentioned earlier, about the sort of learning and unlearning or relearning. We're going to have to be thinking also pivoting to where the advice that not only are we giving, but also that parents and adults are taking when it comes to their kids, and especially if they're parents who are vaccinated, they want to make sure that they're not forgetting that their kids may not be and may thereby still be at some risk. So with that, Scott or Dr. Koehnke, if you guys wanted to add.
Yeah, I would just add, so I am a mom as well. I have a 1 and 4-year-old, and we are having a highly cautious summer because my kids are, of course, not vaccinated yet, although my husband and I are. And so we have to remind ourselves regularly that there is some real risk to children, although the risks are a little bit different than for adults. There is some real risk to children, and we can't ignore that. And so we're just trying to explain over and over to our kids why we have to continue to be cautious. We can't get on a plane yet. We're not going to do these things quite yet. So yeah, I think we just need to continue to really have caution with children. Dr. Lindquist, do you have anything to add?
No, I think you guys covered it well. The only, I guess, one piece I would remind is if you are a person who works with children, so school, staff, teachers, one of the other protections is for you to be vaccinated. So I really would like to see all of us that take care of kids, myself as a pediatrician, be vaccinated to protect kids.
Thank you. This concludes the question and answer segment of our briefing. And now we will go to Secretary Shah for closing remarks.
Thank you, Julie. And before I give my remarks, Dr. Koehnke, thank you for joining us. And I didn't know if you wanted to have any closing comments. And I did want to, I know Lauren Jenks was on as well, and she didn't get a chance to say anything. I didn't know if she had anything she wanted to add. So Dr. Koehnke, first to you.
Oh, just thank you for having me. It's a pleasure to be here and be part of this panel. And yeah, if you are a person having hesitancy, please do reach out to your doctor and ask questions. It's okay to ask.
Thank you, Dr. Shah. And I would just say to be careful in this heat and check in on folks who are less tolerant of heat, including people who are over 65 and your children and people with any kind of cardiovascular related condition, and just make sure your loved ones have access to a cool place to hang out in these coming hot days. Thanks.
Thank you, Lauren. And again, I want to thank again my fellow panelists, especially our guest, Dr. Koehnke, Lauren for being on, obviously Lacey, SheAnne, and Dr. Lindquist. Thank you, as well as Julie. I always forget to mention the person who's moderating us. Thank you, Julie, for doing a great job, in addition to all your colleagues over the last several months who have helped us with these media briefings. I do want to say that, we're getting closer and closer to reopening our state, which is a great thing, and we're all excited about that, but we're still not out of this pandemic. And Lauren said this nicely, so let me just reiterate this, that we are oftentimes when it gets hot, and especially where I come from in Texas, we say beat the heat. And so we want to make sure that people beat the heat, but they also beat the virus. And that is so critical that we do everything we can to make sure that we are not forgetting that as we get into these summer months and it looks like, the skies are blue and, the sun is out and it's hot or it's warm, that we don't forget that we still need to do everything we can to protect ourselves and our loved ones. And the number one message from us is that the pandemic is not completely over. And in fact, we still need people to get vaccinated. So don't hesitate, vaccinate, and really do everything you can to help each other get vaccinated. And with that, Julie, I want to thank everybody, and I want to thank our media partners, and certainly I want to thank you, Julie, and I'll turn it back to you to close.
All right. Thank you as well to TVW for hosting today's live stream and posting archives of past briefings. That concludes today's media availability. Thank you and have a super day.